The topic of thromboembolic disease in kids has been pretty silent for several years. People thought there was either a genetic mutation that happened in children that caused blood clots, or they attributed it to a central line. And really, the incidence of blood clots is not well documented at all in the current medical literature. We know it's increasing. The incidence is definitely increasing within the inpatient population, but more and more as our detection techniques become better with ultrasound, MRI, even sometimes CT, we're able to better visualize the small vessels in children. And once you start looking, the more you're going to find. And so now you start to see specialists, even in the hematology oncology world, specializing in pediatric thromboembolic disease. So as that shift in improved detection and further specialization of our colleagues has become more prominent in the pediatric community, we're now being asked to intervene more often on the thromboembolic disease. Some of the barriers that we have run into in my practice have just mostly been around education, trying to make sure that everyone understands what we have done in interventional radiology and understand how they're expected to care for the patient after having like a thrombolysis procedure, for example. Once you're able to sort of tell them the parameters of what we were worried about or what we're happy about or how the procedure went, then it's so much easier for them to feel confident in how they can care for the patient. And so we've done a lot of education with the PICU, the pediatric ICU. We've done a lot of education with the ER department about, picking up when a child has a blood clot. And then we've worked to establish guidelines within our hospital about when it's safe or not safe to undergo a thrombolysis procedure, working with our hematologists. And so really, it's all about education. The long-term outcomes can be varied, and we honestly don't have a ton of data because we haven't done these procedures for that long in children. We've been doing them for maybe somewhere between 10 to 15 years. When you try and report that type of data in the adult world, it may be a little bit easier to report it because they may not have that much more life to live. But when you're telling a patient that's 10 years old, well, in 10 years, we expect it to be like this, they're only 20 years old at that point. And so our outcomes, as far as we know, have been good, but trying to communicate that with the parents about, we're really going to continue to have to watch this because we don't know what it's going to be like in 30 years. Overall, I would say we have excellent success in treating blood clots in kids because they're just much healthier at baseline than some of the adults that come for a thrombolysis procedure. They don't have all of the comorbidities that adults do. And so it generally makes them quite successful procedures. They don't have near the amount of spontaneous bleeding events after a thrombolysis procedure. And so we're just sort of dealing with overall healthier tissue, which always helps your outcome to be good. I'm passionate about it because I think the procedures make sense. You take something from being there and damaging a vessel, and you get to clear it out and make it better. And the amount of relief that you can have with talking to the parents to visibly see their leg or their arm or the amount of vessels that they have in their neck reduce is very gratifying. You feel like you're giving kids another chance at being able to run and jump and play and do sports and all the fun things that you get to do in childhood that can be thwarted or stopped early when they have a serious blood clot. And then I also feel like we have a very good success rate in reducing the post-thrombotic syndrome and sequelae that that you can have after having one of these types of blood clots. And then, like I said before, providing central venous access for kids that lasts a long time, is durable, and doesn't cause as many long-term side effects, I think that's very rewarding.